And a hysterectomy will certainly cure any problem with fibroids, but for younger women, the consequences are immense because they'll never get pregnant. One of the alternatives provides relief from fibroid pain and helps protect a woman's fertility. These sounds are music to Anne-Marie Conklin's ears. But not long ago, Anne-Marie learned she might be unable to have a baby. Her doctor had discovered large tumors called fibroids inside her uterus. The most common treatment for that disease is hysterectomy, surgical removal of the patient's uterus. For Anne-Marie and millions of others, that treatment would have been devastating.
They're having children later, and most of the issues with fibroids occur at a later age. So for a woman who's uncertain about having kids, we don't want her solution to be so final.
So Anne-Marie had a different procedure called myomectomy. Her doctor used an operating microscope to remove the tumors, then repaired her uterus.
We do an angiogram to outline the anatomy of the vessels of the pelvis.
At Scripps Hospital Encinitas, Dr. Clayton Yamada performs a different procedure. It's called fibroid embolization. He inserts an ultra-thin catheter into the blood vessel and injects a medicine that cuts off blood flow to the tumors.
By decreasing the blood flow, you cause these fibroids to starve, and it results in shrinkage.
I really have decided, unless I have cancer, I'm going to hang on to my body as it is.
That's why Sally Salem opted for the embolization procedure. She says it worked for her, ending the pain and uncontrollable bleeding caused by fibroids. Plus, she was back on her feet in just a few days.
Yeah, my recovery was incredible. The procedure was performed on a Thursday, and I was back walking my dog on a Tuesday.
Dr. Yamada says more than 30,000 women have had the embolization treatment, but he says some gynecologists don't know much about the procedure. To know more about these alternatives, check out our website at nbcsandiego.com.
Good to know. So about 20% of women actually have these very painful symptoms. Okay.
It kind of goes like 20% of women in their 20s, 30% of women in their 30s, and then 40% after that. So it's pretty memorable. And then about 20% need this.
Thank you, doctor, very much.
Heavy bleeding is a problem for a lot of women in San Diego. Sometimes it's caused by uterine fibroids that grow inside the womb. For a long time, the only solution was to have a hysterectomy. But now, there is a much easier solution, and it's the subject of today's Health Focus. Sally Salem was living a normal life 3 years ago when suddenly everything changed.
My first symptoms were just irregular periods. They were getting longer and heavier, and then it just turned into hemorrhaging. And I was hemorrhaging for so long and so much I couldn't even leave the house.
Sally ended up in the emergency room where doctors told her she had uterine fibroids.
Well, at first my gynecologist at the time wanted me to have a hysterectomy and really wasn't telling me about any other options, and it wasn't until I came to Scripps and had the ultrasound the technician told me, there are other options besides hysterectomy.
Sally was eventually introduced to the idea of uterine fibroid embolization by Dr. Clayton Yamada, an invasive radiologist.
There's about 600,000 hysterectomies per year, and about a third of those is for fibroid disease.
UFE is generally performed on women between the ages of 40 and 55 who have benign tumors in their uteruses which have not responded to other treatments. The concept is actually pretty simple. Doctors make a small incision in the groin and feed a thin catheter into the uterine artery. Using X-ray imaging to guide them, they slowly inject tiny round beads made of an FDA-approved copolymer material. Those beads block blood flow to the fibroid tumors, causing them to starve and shrink.
And what's good about any normal organ is it has an ability to develop collateral blood flow or other blood supply to the normal uterus, so the normal uterus doesn't get affected at all.
Sally says she had minimal pain and was back to normal in about 5 days. And since then, she has never had any problems.
If you have fibroids and your doctor's recommending a hysterectomy, don't rush into it because you're trying to solve the problem, and take some time to investigate it because you might be able to save your uterus and still be able to have the problem solved.
Now, women who want to get pregnant might want to try and have their tumors surgically removed instead of having UFE. And like all procedures, there are some side effects to consider. Cramping is common. Some of the rare problems can involve an allergic reaction, infection, and early menopause. This procedure is covered by insurance and has been performed on about 35,000 women so far.